Now, I did want to talk to you about what are some areas that you specifically study when you're doing coursework in school? Do you do
Um,
nutrition? Do you
it's
do behavior? What do you do?
yes,
Training?
yes, yes. It's
Okay.
actually broad. It's really broad because we cover so much. So
Mhm.
yeah, I mean, we have courses in, basically like the medical side of it. So there's the medicine as far as learning your anatomy, the common diseases, the common body processes. We have pharmacology to learn our medications and what they're doing in the classes. We had behavior classes. We have lab classes, being what we actually will do in the lab in the clinic. So, looking at blood samples, reading urine samples, looking at fecal samples. So, those are like actually how you're going to do it in the clinic. So,
Mhm.
we get a broad section. There is a large animal course, which was not my favorite. And there is an exotic animal course, and there is a laboratory animal course. So, we have each of one of those
Oh.
because our field is so broad, you could go into any of that area. You don't necessarily have to specialize in that.
Hmm.
So you could go work with exotics, you could go do your, horses, cows, goats, that kind of thing. So we
Right.
do get a little taste of all of that as well. And all of that is on that national exam we take as well. So,
Hmm.
I got like, what's the gestation period of like a guinea pig on my
Hmm.
test
That's
because
so
we
wild.
cover all of
Well,
that
yeah,
as
I
well.
had
So
guinea
it's
pigs. I
really
took them
broad.
to the
Yeah.
vet. Yeah.
And we don't specialize down to, like more of, like the human side. Yeah, there's the general doctor, and then you're going to go into all your separate specialties. Like ours is such
Sure.
a crash course in everything,
Hmm.
because there isn't so many of those avenues for us later, so anybody could get into it. And yeah,
Right.
there's all of that is covered.
That's excellent. Um, Now, oh, I was going to tell you the funny story of how I met Jenny Price.
Yes.
Okay, so I learned how to be a trainer somewhere else, a place called Good Dog Bad Dog. They're not around anymore. And then I opened up my business, and I was just doing in home and pet sitting. And then I was like, you know what? I'm sick of driving all over God's creation, even though I still wound up doing that anyway.
Yeah.
Then I had a building. So I expanded my business, rented a facility, and it happened to be in the strip mall that was right across the street from the college in
Okay.
Pinellas. I guess, is it still Pinellas Park? Yeah, it's Pinellas Park
Yeah.
on 66th Street.
Mm-hmm.
And open and all that stuff. And one day I got a call from somebody inquiring about training, and I happened to answer the phone, and she's asking all these specific questions, and like I can't even remember exactly, but probably things like, my dog is this and that, doing X, Y, and Z. I don't know what to do. And then I would talk about it to her about it and what I would do and da da da. And then by the end of the conversation, I knew she told me who she was, and she was like, "Okay, I needed to find out what kind of
So it
a
was a quiz.
trainer you were." It was totally a quiz. And I was like, "Holy shit." I was like,
Yep.
"Okay." So,
Yeah, that sounds like her.
yeah, so she would come and sit in on some classes, bring her students over, have her students like kind of check out the you may have seen some video of it actually, because she uses it sometimes, some video behavior, like body language stuff
Yeah.
in the daycare and that type of
Hmm.
stuff. So it's really important that you guys get that
Yep.
training, in my opinion, as a dog trainer, so that you can understand a little bit of body language. Is it like a one semester course type of thing, or is it you know
Yeah, so the behavior course is 1 semester. It is
hmm
like your very beginning. So
yeah,
you
oh
get
yeah,
like terminology and behavior, and like I think it was office procedures, which has changed now, which is just how like proper etiquette and what to expect in like a clinic.
uh-huh,
And those are like your starting classes that you have to take. So yeah, I had Ginny Price. She was one of my first
yep,
teachers.
yay,
But yeah, you learn the behavior right away. So it is like,
yeah,
how to read their body language, the proper way to approach them, the positive reinforcement, that kind of thing. And then we had to clicker train a cat and a dog. That was required,
Yes.
which in my head I was like blown away that we were going to train a cat. That was never going to happen. And don't you know, we did it.
It happened.
So it happens. Yeah, but it was very helpful because I entered the program relatively young. I had like, some pet sitting. I loved animals. I had not been in any real clinical experience. And so it's a completely different environment and approach. You're not meeting those animals in their homes. They're not a fun, just friend's dog that you're playing with. And it was
Right.
vital information that you're getting as far as, how to approach them and how to read their body language. And then also, what the right way to handle like their stress and behavior responses. So it was, we get that right away. And then in some of your more hands-on like clinical labs as you go, they're still teaching you like, okay, this would be the right way to like leash the dog, walk the dog, things like that. So even though that's more physical, it is still going back to behavior as far as like what's safe for them and how they're going to, how you're going to respond to each other. So you do get it throughout the whole thing, but that baseline behavior program behavior class is the first one you take when you start, which is a great thing.
Yeah, it is. Just to recognize some basic body language in pets and to clicker train is amazing. I love Ginny, of course. It was like, but really, I mean, clicker training is just something that, you can mark very specific behavior. He's looking at his reflection in the stove. Yes, he's so funny. But you can mark something from very far away and have a different effect than just saying yes, or in my opinion, and timing and everything, and doing it on different species is really cool too, because they learn differently a little bit. Timing is different.
For sure.
It's really a valuable course, I think, to take. You touched a little bit, but what made you want to get into this field?
Love for animals, that's what everybody says. But I loved animals from the time I was a kid. I was the one that like brought the stray kittens in and the broken bird and like, did all that. I did not, as a young kid, consider veterinary field at all because I thought the medical aspect of it would be like too much for me. It would either gross me out or be too hard. And then I got a little bit older, like late teens, and that was when like all of those like ER shows were really popular, and also like the live ones.
On
and I
Animal
became
Planet.
fascinated by them. So like fascinated, wanted to see it, wanted to do all that, and then was like, I think I want to pursue this. So I went initially to tech school because I didn't want to just walk into a clinic and not know what I was doing. And it was, a 2-year program. So I was like, I can start here and see. And I fell madly in love with it and never looked back. So
it just was like, this is it.
Yep. Yeah. And I love, I like the animal part of it and the behavior part of it, but I really love the medicine. I mean, it's fascinating to me as well. What their bodies do, what we do, all of that. So the part that I thought would deter me the most is actually the part that I like the best. I love surgery, like, bring it on.
You're like, let's see that. Let's do that. Let's fix that.
But it really is. And a lot of people are like, oh, your job is so hard. Isn't it hard to do it? And it is. Don't get me wrong. It can be very sad, very frustrating, very hard. But I always am like the bigger picture person where we're doing way more good than we are harm. We're advancing the field all the time. We're advancing, what people are even thinking is the norm for having pets in their veterinary medicine. And, whatever we can do to help them, I would rather be a part of than not.
Absolutely. Yeah. That's amazing. Yeah.
Yeah.
It's like you found your passion, and you're not only there for the animal, but you're there for the people.
Yeah.
But which is huge, but there is that, I just learned this new phrase from another interview I did about compassion fatigue.
Yeah.
And I was like, oh yeah, they have like some terminology to it. And I didn't delve that far into it, but I know that it can be a struggle. And I don't think a lot of people might not think about that, like
Yeah.
the end of the professional, because we're so in our own grief that maybe
Yeah.
we're not even, it's hard to see that or whatever. But you guys experience grief,
Yeah.
obviously, and stress and
Hmm.
everything.
Yeah.
So,
Oh, yeah. It's definitely prevalent in our field, and what we do, and all aspects of it. But your like shelter medicine and your like emergency medicine, it's even stronger because those are your real tough situations where you're seeing like the animal abuse or the traumas that we can't save and things like that. And they're
mhm.
also like, I mean, I guess I wouldn't call them like not that you don't get any acknowledgement, but it is something that's hard because like a shelter medicine, there isn't much that you're getting, back from other people. Same with like the emergency. Like you might work a 14-hour shift and go home and like you're just going to do it again the next day. So
Mhm.
those are areas that can be really tough. All of the field can, but that's where the compassion fatigue, we see a lot of it.
Yeah, for sure. For sure. Because yeah, you don't get that. You get it. It's like your patient is a dog or a cat if you're a small animal, and
Hmm.
you're not getting that feedback from them, you
Yeah.
know, where,
Yeah.
and you're not getting anything from the owner either. And then you have that quick time with the owner too. So yeah, um, definitely. Yeah,
Yeah. And,
I can't even imagine.
yeah, and I've done a little bit. We had to do a shelter rotation when we were in school. I haven't worked in it otherwise, but I did emergency for a lot of years as well. And then I do, a small animal practice now. And I love the emergency medicine aspect. You get to see a lot of really cool things, learn new stuff.
Right.
They're kind of like the front of the field for discovering what we can and can't do in some
Uh
ways.
huh. Yep.
But I come back to small animal practice, and I think a lot of it is because of the clients. So when you
Yeah.
work in emergency, you meet those people and you may never see them again. You meet the patients and you may never see them again. Where
Mhm.
in our, day general practice, like we get to see the people again, we get to see the dogs again. I've seen dogs go through their entire life cycle now, and
Right.
then
Yep.
meet them as puppies, help them out through all of it, and that is
Yep.
really rewarding. I do enjoy
That's
that a
yeah.
lot, that we
Yep.
get that better one-on-one connection with you as the owner and the patients.
Yeah. And then we come back to you with our next furry children.
Yes.
You're
Yep.
like, hey,
And and everyone
yeah, boy.
says, "I'll never do this again," and I tell them, "Yes, you will," and then they come back.
Yeah. Oh, yeah. I've never said I'll never do it again.
Good. That's
It's
good.
never, that's like not
I
an option.
understand. Yeah, I totally understand the sentiment in the moment. And, it's,
Yeah.
you and I have been in this for a long time and not
Yeah.
everybody else has. So in the moment, they're
Mhm.
like, it's too hard. I'm never going to say goodbye again. And then I'm like, yes, you are. Because
Yeah.
you have a lot to give, but they have even more to give us. And at some point, you'll be ready again.
Yeah, definitely. And I always think about what about the dog, or a cat, if that's sitting in the
Hmm.
shelter that's
Yep.
waiting for you, you
Hmm.
know?
Yeah.
So
Yeah.
you gotta do it. It's
Yeah.
like I just wouldn't be able to. I mean, we waited such a long time because I needed to get a piece of equipment for my wheelchair so that I could actually go out into the yard with Tony.
Yeah.
So we waited for a long time because I had to get the funds and did some
Yeah.
fundraising. And it was like I didn't even that curtain that's pulled over. I didn't even open that because that's
Yeah.
where I let Troy out all the time.
Hmm.
And I was like, nope,
Yeah.
I didn't open the door. I didn't do shit. And then I was like, it's been a really, really, really long time. And
Yeah.
finally we
Yeah.
got things together with equipment, and I was like, let's go. Let's do
Yeah.
it. We had plans, and we got complete opposite of what we were
I
going to
was
do.
gonna say, and sometimes you have this picture, this plan, or a timeline, and then like all of that like just gets blown to smithereens with like the when you see the first cute one.
We flushed it down the
Yep.
toilet. We
Or they
burned
pick
it
you,
down.
a lot of times I think the animals pick us, whether that was our plan or not.
True. That is very true. I mean, I saw him on Facebook in April, I think it was. No, we got him in April, in like March. He had his little NG tube, and he looked just
Yeah.
so sad and everything. And then I saw him in April, And I was like, oh, look. And so we were ready. We were going to go that weekend. We were going to go to the shelter here. The dog they have to get along with other dogs, but they could
Yeah.
have been there the longest or returned the most. And Tammy wanted a girl. So, all right, let's go. We have a puppy that's a boy. It's just like, what the hell did we do?
Yes.
But it's true. Like, you can try and plan, but then, things happen in life. But what's your most favorite surgery?
Ooh. So
Or
I
do
like
you have a
anything.
favorite?
Yeah, I like anything that's soft tissue, which is more so dealing with like in the abdomen, things like that. I think our foreign body surgeries are the most fun, which probably sounds
Oh,
terrible.
you know what? Let's talk about that, because that's also a
But
trainer perspective. Let's hear your end of the foreign
so just from a
object.
surgery perspective, they are fun because it's always a guessing game. What did they eat? What did they swallow? We may take some bets in the office. But the other side of it that's nice is typically we can do the surgery, get out whatever's in there, and they recover beautifully and are like happy and wagging their tails back to normal in no time, probably reoffending in a couple months. So, but yeah, so I mean, it's not like the most common thing we see, but we do see it a lot. So these dogs that, eat something they're not supposed to, and then it gets stuck somewhere along their GI intestinal tract, and at some point we have to go in and get it out.
Damn. Okay,
Yeah.
so I don't know if you roughly the statistic of a basic age range that you're seeing this, and is there one breed over another that's more prone
Yeah.
in your eyes
Yeah, I would tell you
to
that,
show
like,
up with us?
6 months to 2 years is going to be your, biggest offenders. Of course, they're
Uh-huh.
still learning, being trained, hopefully, and they're eating everything in sight, so they don't
Yep.
know. But I will say, I have a coworker whose 10-year-old dog just had his second surgery this year.
Oh shit.
So it also depends on the dog, because
Yep.
certain dogs just have this, like, love of eating things they're not supposed to and going after it.
Yep.
I am a Labrador Retriever lover. I'm on my third one now, and they're definitely known for doing it. And there's just, that insatiable appetite, and like all other logic in their head goes out when they see something they think they want to eat. So I'm fortunate to have made it to a year with her and not have that happen yet, because I know it's a possibility from what she's done, and we haven't had it. But yeah, I would say your bigger breeds, your bully breeds are kind of similar too, because they're like just like not the smartest love bugs ever, and they'll eat whatever. Same thing too. But we've done it in like, we have a dachshund that we've taken stuff out a couple times, so it just depends. It just depends.
All right, there's nothing more. I would think like maybe labs and probably bullies too, but that's is is the 10-year-old dog what breed is that 10-year-old dog?
It might be a flat-coated retriever.
It just might be one.
It might be. Yep. So I think it's his second or third surgery, but his probably like fifth or sixth like incident of it could have happened, but he was fortunate enough to like pass it or vomit something out. And like you're talking probably one of the best trained dogs in that, is in our practice, and still cannot be trusted not to eat a sock or a mulch.
Nope. No.
So
no, you can't. You can't.
Yeah.
You can't trust. You can't. It's like, and it doesn't matter the age, especially. I mean, but even if you do all the quote unquote right things in the beginning, training wise and preventative and blah blah blah, some of those dogs are just, they have that propensity to do that. Whereas like we had Troy, and Troy was like, I didn't meet Troy till he was like 2, and he already had, like, he was raised by Tammy, who was just a regular dog owner. No crate, no nothing. He's like, yeah, game on. Ooh, a tissue box. Let me run out. I have my screensaver it's his head and a cone. Oh, he has a cone on, and the tissue box that with the tissues. and it's covering his face, but you know it's
Yeah.
him.
Yeah.
At
Mhm.
10 years old, 11 years old, we're still, he was still
Yeah.
doing these things. It's
Yeah. Yeah.
crazy,
It's
but yeah.
definitely some of them you just like, you're not going to break that from them. It's just
No.
ingrained. It doesn't
Yeah.
matter. And
Totally. Yeah.
some I'm hoping my latest lab, I'm going to break that from her because she has an obsession with anything paper. We're eating it. It's gone.
Yeah. Paper's interesting. I don't know
Yeah.
what it is.
No, me neither. It does. I don't think it
Tissue.
would taste good. Yeah. Tissue, paper towel,
Yeah.
you name it. If you set it down, it is gone.
Yeah. And it's clean. It could be clean anything.
Yeah.
Doesn't have
But
to
I
be a
don't
dirty
understand.
tissue.
Yeah. I was like,
No.
that can't taste that great going down.
Nope. And they're like, yeah,
Yep.
tissue
Yeah.
everywhere and
Best find
stuck
ever.
to
Yeah.
right. Exactly.
Best find ever.
Exactly. So, okay. So, soft tissue stuff is one of your favorite. What's like most challenging to you, in just like, but challenging in like a good way to you when you're dealing with certain issues with dogs?
Hmm. Um, I
I don't know.
guess I
That's
don't
a
know.
weird
Challenging.
question.
Yeah, I don't. I guess challenging
I
in a
don't know.
good way is
Well, you
kind
know
of a
what?
weird
Fuck
thing.
that. Fuck the challenging. Never mind. What's like the hardest thing to deal with? Like when you're dealing with a dog that you see he's got potential, and but the owner's like, whatever.
Yeah, I think we call it owner or client compliance. And that is
Okay.
a hard thing
It is.
because, whether it's a behavior or, hey, they need some socialization, or more often for us, the medical side of it, hey, they might have some allergies and you need to restrict these things, or you need to keep them
Mm-hmm.
on allergy medication.
Mm-hmm.
And that is really hard because we can educate them and give them all the information and all of the treatment, but like when they step out the door, we can't like do anything else to really make sure it happens. And so when it's something that like, hey, this dog was sick or had a flare up and we treated it and we told them what to do, and then 3 months later it's again, and 3 months later it's again, because they're maybe not following up with it,
Right.
and that dog could have been more comfortable or pain free
Yeah.
or something like that. And honestly, what it all, not always, but what a lot of it goes back to is finances, which is by far the
Sure.
most frustrating thing in our field for everyone, our side,
Yeah.
the client side, for sure, because
Yeah.
unfortunately, we don't have pet insurance like we do in the human side. So
Mm-hmm.
even though there is pet insurance out there and it can be beneficial, it's not, doesn't work the same way. It's completely separate from any of your veterinary practices, and
Mm-hmm.
you as the owner or the client are still going to pay everything up front and then hope for reimbursement from your insurance company.
Yes.
So it's costly. It's always been costly because of that, but then the
Right.
way things have progressed the last few years, things have become exponentially more expensive, which is how
Yeah.
the entire country is going. But our
Yeah.
field is a lot, it's a lot more expensive as well. So that's always the hard part because, some won't spend the money and a lot of them don't have the money. So like you can't
Mm-hmm.
really be frustrated with that.
Right.
And we just have to help the best way we can. But it is upsetting when like there are things we know we could do or that could be done that would make that patient way more comfortable or like
Mm-hmm.
resolve their entire issue. But because finances are the limitation, we can't do them.
Right. Yeah. I run into the same thing on my end.
Yeah.
And it's hard and it can be frustrating, but yeah, you could just, do the best you can with them and meet them where they're at as best as you can, really, at the end of the day, because,
Yeah.
I think for me, I feel like I'm an advocate for the dog because did your dog just get something else?
No, I'm in the office and my cat is
Okay.
in here with me, and she just decided it
Hi,
wasn't time
kitty.
for a nap anymore and she'd like to leave.
I
I'm gonna
want to
let her out real
leave.
quick.
Yeah.
Yeah,
Okay,
she
go
says,
for it.
"Don't lock me in this
She's
room."
so funny. Yeah. No, you guys are
Also,
boring.
it's dinner time, so she's like, "I
Yeah.
gotta go."
Yeah. Maria, you're talking too much to Katie. So
That's all
I
right. My
need my
husband will feed
mama
him.
around.
I probably have about 10 more minutes, and then might
Yeah,
have
yeah.
to
Same.
scoot.
I just realized how late it was, but yeah.
Yeah.
Um, did you let her out?
Yeah, because
Okay,
she would
cool.
have started screaming in another minute.
Yeah, for sure, for sure. So okay, so what's your favorite part about doing your job?
I mean, definitely the positive outcomes are the best part of it.
Yeah.
It was, something life or death and we just saved them, or it was something minor that we could still help them out and save them. It's great to see the whole life cycle, see a puppy through an adult and all that. That's like really awesome. But
Yeah.
more so, it's, giving comfort to those that need it,
Mhm.
and something that, like, if they hadn't made it to us and if we hadn't helped them, they would have been left stranded and like wouldn't have had the outcome that we could have offered them. So that's really great to
Mhm.
know. And then
Yeah.
a lot of people will not understand this or they don't get it, but I actually am really happy that we can offer euthanasias,
Yep.
because that is something that you can't do on the human side. And
Mhm.
animals are so much more stoic than we are, so they're going to stick it out and they're going to push
Mhm.
and they're going to let themselves wither away and have a lot of pain for
Yep.
us. And
Yep.
so I actually think that it's a gift that we can offer that to them.
It is. It really is.
Yeah. So, and that's
Definitely.
what everyone's like, isn't it the hardest part? I'm like, it is hard. It's always hard.
Mhm.
Nobody wants to say goodbye, but
Yeah.
I would much rather let you, go with some peace or a little bit of dignity and not
Mhm.
have to, just keep suffering through something that is
Right.
not going to improve.
That's right.
So
That's
I
right.
like that we can offer that, and that
Yeah.
you guys, as their owners, can be with them through the whole thing
Mhm.
and not have to worry or be caught in some situation where you're, at some other facility or watching them, at home, not knowing what to do.
Yes. And I will say that I have had two horrible experiences here on the
Yeah.
East Coast with two different
Yeah.
vets, with two different dogs, obviously. And I called Dr. Masters up after Troy and I was like, what the fuck are your protocols? Because what the fuck just happened?
Yeah.
And he's, of course, he's so approachable and he told me what he does and stuff. And I was like, oh my God, okay. That's never happening again. But
Yeah.
in it is, I've gone to you guys for years and yeah, my babies have, I've had to bring them in and
Hmm.
sometimes it was like, well, most of the time it's like, holy shit, what's happening,
Yeah.
and you have to make that decision right then and
Hmm.
there. But the environment that you guys set up is just amazing. The process is so peaceful. It really is. And it's like, and the support is great, and that's something that really is a gift, and I think it's the most humane thing, for whether it's end of life or injury or illness or whatever, that we
Yeah.
can give to them, for sure,
Yeah.
to
Hmm.
take them out of that misery, and also ourselves, and because we don't realize the amount of care that we have been
Yeah.
giving that pet until it's over and done
Yeah.
and it's had space between it,
Yeah,
when
and
it's
that's what, yeah,
passed.
it is hard. It's hard for a lot of people to, like, recognize that exactly how you're
Hmm.
saying. But yeah, it is something that, it is good that we can offer that and, like, not have to just watch something continue on or suffer and, know they're uncomfortable.
Exactly. One more thing before I let you go. What would you
Sure.
tell young people out there who are interested in pursuing this, or maybe not even young people, but I'm thinking like high schoolers or whatever, or anybody who wants to get into the field of being a vet tech? Like, what should they
Yeah.
do? What's the first thing they should do, no matter where they live? Because we go at we're worldwide.
Yeah. So there's kind of mixed reactions because sometimes I'll tell people, don't do it. Only because it is not, like I said, it's not a thankless job. We get our thanks in a lot of different ways. But unfortunately, veterinary technicians do not get financially compensated very well.
Hmm.
It is something that, is improving and we're working towards all the time. But I've never been in this field and not held 2 to 3 jobs. And that is the only
Hmm.
way I would survive. So that is something that also adds to that burnout, is because, you work long hours and you put a lot into it, and then you come away with barely being able to support yourself. So I would not deter anyone from doing it, but just be prepared that, it can be a long haul, although we're always hoping that we're going to keep working towards that being better recognized. And then my next thing would just be to get out there and try to get some experience and volunteer and see where, who will let you follow along and look, because you have no idea what all you're going to encounter until you get into that hospital. And like I said, once I went into it, I loved it, and I thought it was, great, and I knew I wanted to go with it. Not everybody might feel that way. They may, be like, oh, this is not what I thought, and want to go a different direction. Some people will realize they do like more of like that. Hey, I like the behavior stuff, and I would like to help the people in their homes and things like that, and not the medical side of it. So then, but you have to expose yourself. You have to jump in. You have to get some experience, and then you'll know better what you want to do. And I also always say, if you think you want to be a veterinarian, then make sure you're preparing like way early for that, because it's a very competitive area. So you got to be like all in early on.
Yeah, for sure. For sure. And education, and you went to SPC?
Yes. Yeah. Okay. So the Saint Pete College veterinary technology program, which has been around for like 50 years. They're one of the longest standing and like most recognizable. So they do a wonderful job. I was fortunate enough that I went to the college in person and learned from great instructors. They also have a fully online program. So for those that, don't know if they can do it or want to start out with that, it's great. It was also meant for those people that were working in the field. So those on the job trained that decide, hey, I'd like to go back and get the education. I'd like to go back and get my, certification, and then maybe pursue something more. So you're already working in the field. You're not expected to stop that. We're going to work with you on it. And I say we, because now I teach for that college part-time as well online. Which I love. Yeah, I love it. It's very nice.
What are you teaching?
So,
way to bury the lead. Way to bury the lead.
I teach some of the clinical classes where they're basically going out into those clinics where they have to get experience. So one of them is, we call it work practicum, but basically you have to do so many hours in any kind of day practice, and then you also have to do so many hours in the shelter. So I'm monitoring those students. They're reporting back to me. They're committing a set of skills. I also do some of the like radiology courses, and we have what we call blood lab, where you're learning how to look for all the different blood qualities and recognize conditions, which are some of my favorite ones as well. So it's actually been a lot of fun. I didn't know how I would feel about it early on, but it is really nice to be able to like talk to those young ones and those students and communicate with them. And there is a lot of different experience out there with the clinics they can go to, just like you've had as well. And they're not all created the same. I am really fortunate to work at one that we call a unicorn clinic.
Yeah.
So when you find your unicorn, it's your perfect match. It's, the rare one that like does everything you could want. And so I like to encourage those younger ones and those students that, they might have different experiences. They might be at a clinic they didn't love, or the shelter isn't for them, but they will eventually find their unicorn clinic, and to just stick with it, because they have done it for a reason. They're there for a reason.
Yeah, for sure. That's great advice, Katie. Now, if anybody has any questions for you, is there any way they could reach out to you, an email or anything? Or
I can give you an email. They can definitely, reach out to me if they're wanting to learn more about, veterinary technology or the schooling or things like that. So I don't know, you can pop my email up there, but it's the ksutton85@gmail.com. So I check it regular-ish.
Okay.
Between work email and school email. But I am very passionate about our field and about the education and about pushing it forward. So anybody that I can help with that, and anyone that's interested, more than willing to answer questions.
Awesome. All right, great. That's good.
Okay.
I will definitely post everything and break it up into at least 3 little
Sure.
sessions for us. Hang on one sec. I'm going to end the recording, but I
Okay.
need you just to hang on and make sure it uploads correctly
Okay.
once I end it. But
Yeah.
really, thanks so much for doing this.
Yeah.
I've
No
been wanting to do
problem.
this for a long time, so it's good to
Yeah.
get
Yeah.
different
Yeah.
perspectives. So I
Yo,
appreciate
no,
you.
it was
Thank
cool. It
you.
was fun.
Yeah, awesome.